Today we are going to discuss a very rare case of plexiform tumor of uterine corpus. Case history and gross findings. The case belongs to a 40-year-old woman who presented with menorrhagia of 2 years duration. Her symptoms did not improve on medications. Since her family was complete, a total vaginal hysterectomy was performed. On gross examination, the total hysterectomy specimen measured 9.8 into 6.5 into 5 cm in size. It was unremarkable externally. On cut section, endometrium measured 0.4 to 0.8 cm in thickness. Myometrium showed a single intramural fibroid measuring 1.6 cm in size. Rest was unremarkable. Here is the uterus cut surface, and we see that there is a fibroid which is intramural and possibly submucosal also, and projecting into the uterine cavity. So this is a submucosal fibroid, not entirely intramural. The rest of the myometrium and cervix are unremarkable. On microscopic examination, this tumor was made up of smooth muscle cells cut in cross sections, and the cells were round, arranged in nests, and the cells were arranged at places in cords, and these were separated by hyalinized fibrous material. So we are seeing nests and cords of round cells at this magnification. Higher magnification showed that these cells are round and they have clear cytoplasm, and they are arranged in round nests, and the cells nests are separated by fibrous stroma. Here we see an area where the cells are arranged in nest and cell cords here, cell cords. So arrangement of cells in cell nests and cell cords in this tumor, which is basically epithelial leiomyoma. So the chief microscopic findings we had in our case were that there was a well circumscribed leiomyomatous tumor. Predominant cell population was round with central vesicular nuclei, moderate amount of pale eosinophilic or clear cytoplasm. Overall morphology of the tumor was that of epithelial leiomyoma, areas with cells loose, detached from each other and arranged in nests or single rows resembling indel file pattern were seen. There was no necrosis and mitotic figures were occasional. Diagnosis of plexiform uterine tumor was made. What are plexiform uterine tumors? Plexiform tumors are a variant of epithelial leiomyoma, and these are rare lesions. Initially, these were thought to be uterine glomus tumors. Generally, these are incidental findings in hysterectomy specimens from middle-aged women. Small plexiform leiomyomas detected only on microscopic examination have been called plexiform tumorlets. These tumorlets are frequently solitary and submucosal in location and can be multifocal and located anywhere. They are defined by a plexiform architecture and size smaller than 10 mm, that is for plexiform tumorlet. On microscopy, these tumors are well circumscribed, completely surrounded by normal myometrium, and are composed of round or polygonal tumor cells with scanty to moderately eosinophilic or clear cytoplasm. These cells are arranged in nests or serpiginous cords. The typical plexiform pattern is produced by the hyalinization of the stroma present around these nests and cords. Most of these tumors are benign, but malignant tumors are known to occur. Differential diagnosis of these tumors include metastatic invasive lobular carcinoma, endometrial stromal nodule, endometrial stromal sarcoma, poorly differentiated carcinoma of the endometrium, adenomyosis, and picomas. Metastatic invasive lobular carcinoma is to be considered in cases which are associated with carcinoma of the breast, and IHC investigation for pan-CK, smooth muscle actin and desmin can differentiate carcinoma of breast from plexiform tumor of the myometrium. Carcinoma breast will show positivity for pan-CK, while this tumor will show positivity for smooth muscle actin and desmin. Then endometrial stromal nodules and endometrial stromal sarcomas, they are without glandular components and are made up of small round cells and may resemble leiomyomas. And in cases where there is a difficulty of differentiation from plexiform tumors, IHC for CD10 can be helpful in differentiating, as endometrial stromal nodules and sarcoma are positive for CD10, while plexiform tumors are positive for smooth muscle actin and desmin. Then poorly differentiated carcinoma of the endometrium also can sometimes be mistaken for plexiform tumor because of the epithelioid nature of the cells, and again differentiation can be carried out with the help of IHC for pan-CK, smooth muscle actin and desmin. Adenomyosis sometimes cannot have glands, it can be just a pure collection of stromal cells in the myometrium, and then it can be mistaken for plexiform tumorlet and can be differentiated with the help of CD10, SMA and desmin. Then there is a new group of tumors which are called picomas of the uterus, and they have almost similar morphology, similar to plexiform tumors, but these can be differentiated with the help of IHC stain CD1A, which is positive in picoma cells. So we end this presentation here, and you can view large collection of histopathology slides in the set prepared by DigiScan. Thank you very much.